we said was caused by atherosclerosis. I'm just reviewing. Was caused by atherosclerosis. We said that the patient would be cold. They would be pale. They might even turn blue and become cyanotic. They didn't have any hair on their legs, so hairless extremities. We said they have, if we didn't say it, we better say it, poor capillary refill. Poor capillary refill. We said they have weak peripheral pulses. We said when they dangle, they turn rubor. Examples of PVD or PAD, same damn thing, was intermittent claudication, Berger's disease, and or Raynaud's disease. We said they would have painful ulcers on their toes, their heels, they would have an ankle brachial measurement or index. Ankle, I would write it. Everybody would write that. Ankle brachial index of less than 0.5. Ankle brachial index of less than 0.5. The patient may have paresthesia, which is numbness and tingling. The complication is amputation from gangrene. So you had to know gangrene. The complication is gangrene and subsequent amputation, especially with Berger's. Berger's, it was like, oh, Jesus. These patients usually always smoked. Berger's was guaranteed to smoke. The atherosclerosis that all of them have caused ischemia. We said they need to never, ever, ever wear restrictive clothing or tent hose. We said they need to dangle. We said we needed to decrease their afterload with statins or antiplatelet aggregates. I should say and, not or, and. So statins and antiplatelet aggregate. They needed to stop smoking. And we needed to watch their kidneys. Okay? Now, we did not talk about venous insufficiency, but I want to give you a select all on that. It is a lot of the things we said, but the opposite. So instead of dangling for PVD or PAD, what do we do for venous insufficiency, you guys? Elevate. So don't dangle, elevate. And for venous insufficiency, I tell you to remember this. STRAW, swelling, sometimes tenderness. Instead of pallor or cyanosis, redness. Instead of cold, the patients can have warmth. The patient is at risk for a DVT, which is all of these symptoms. So they're at risk for a DVT. Now, of course, swelling, another name for that is edema. Because they're at risk for a DVT, very often we treat this patient with an anticoagulant. They always have hemorrhoids because those are varicose veins of the rectum. They're at risk for JVD. They're at risk for cellulitis. They're at risk for liposclerosis. Liposclerosis is thickening of the tissue, thickening of tissue. They're at risk for ankle ulcers that drain but are painless. And they have dark brown, thick skin. Dark brown, thick skin. Now, patients at risk for venous insufficiency, pregnant patients, pregnant patients, obese patients. Oh, I know what I wanted to do, make sure I do this, you guys. Put flaky here. That was on there. Flaky, dark brown, thick skin. Flaky. So the risk factors include pregnancy, obesity, estrogen, immobility, you want your patient to wear TED hose, elevate their legs, never cross their legs. If it's after surgery, pump their ankles. You have those sequential TEDs, what are they called? Sequential compression devices, SCDs, sequential compression devices. The number 1 and 2 risk factors that'll give this guy a DVT include surgery and immobility. Surgery and immobility. Number 1 is surgery, and number 2 is immobility. That will give this guy a DVT. Patient does have varicose veins. Okie dokie, smoky. Let's go for the respiratory side. Take out your respiratory packet. Is there anybody here today that's not going to be here Monday?